What's going on, everyone? Welcome to today's pandemic update for Friday, May 12th, 2023. Hopefully everyone is staying safe. If you had to take a COVID test, hopefully you're testing negative. If you're new to my channel, this is the time of day where I do the pandemic update with the latest updates on COVID, monkeypox, any health-related topics, celebrity health news, and anything else in between. So if you're new to the channel, hit that subscribe button down below. Alrighty, let's get into this. Today, India's cases have dropped to 18,009. That's active cases. They added today 1,580 cases with just 12 fatalities today. So it's good to see they never really had a major surge in deaths with this wave. Not to say that maybe some did not get reported on, but overall they did not have a major death wave with the XBB.1.16 variant as of yet. Now we move on to this. This is a rock group, South Sin. They had dates lined up for Asia. Now they finally announced the rescheduled dates, which is going to be sometime at the end of the year. The reason why they had to reschedule part of their tour is because some of their shows were canceled originally due to a member of the band catching COVID. And if you go down here, it sounds like they had a fairly serious case. I don't know if the person was vaccinated, not vaccinated, vaccinated and boosted. I don't know what their deal was, but it sounds like they had a serious case and it stopped them from performing for a long time. And the rescheduled dates are going to be November 3rd through November 16th. Now moving on to this, and this has to do with monkeypox. If you have not heard, the WHO says they're ending the monkeypox emergency as of yesterday, which really makes no sense to me because there have been new cases that have popped up in the United States, in multiple states. We know of Chicago and LA. Apparently there are other states in the United States. We don't know what those states are, but the CDC says multiple states, and some of them are in the vaccinated. We also know of other countries that are dealing with COVID cases. We know that, not COVID cases, monkeypox cases. We know that Australia found a new monkeypox case recently. We also know that, I believe, South Korea, and there's others. I think it's 13 countries total. But now they're finding it to be the time to end the emergency right when new cases are popping. It doesn't make any sense. And this says here, the disease will be neglected. Scientists react to WHO ending a monkeypox emergency. I agree with this. I think what's happening is they're ending it, and they're only going to need to bring it back again, say a month from now. But who knows? They may not actually bring it back, but I definitely think we're heading into a resurgence of monkeypox. It may not be a major one, but there's definitely going to be more cases to be had in the coming weeks. All right, this is interesting. Astronomy tool can now detect COVID in breath. So a tool that astronomers have been using it's been found to be effective against detecting COVID. And look here, you can see this in this picture here. You can see here's a man taking a breath of what, might potentially be, this smoke here might potentially be COVID particles. Well, apparently this optical frequency comb can detect the signatures of the COVID-19 disease and other diseases as well. I have tweeted the link out to this on my Twitter page. If you want to check it out, go at it and read the whole thing. All right, now this. The brain fog of long COVID is a serious medical issue that needs more attention. This is a headline that I can agree with big time. We've seen studies for COVID, we've seen studies for long COVID, but we have not seen enough studies and attention done on how COVID is impacting the brain. I think there needs to be more studies done for this. That sudden brain fog, which is basically, remember the old phrase before COVID where someone would say, "Oh, I'm having a senior moment." They just randomly forget things. Well, that happens rather frequently with long COVID patients, which is called, quote, brain fog. And we don't know why that really happens. We know COVID can impact the brain, but we don't know the whole scientific reason behind it. So yes, it does need more attention. And if you want to read this article, I will also tweet this story out as well, if I haven't done so already. Alrighty, moving on to this. Maine, this is the state of Maine, sees its first measles case in 4 years. This is not good. There's a measles case in a child, and it's waiting confirmation from the Centers for Disease Control and Prevention. And that is the national CDC they're waiting from, not Maine CDC. If those who don't know, Maine does have its own Centers for Disease Control. That's what they call their health department. And it's waiting for confirmation. And if it's confirmed, it's their first case within 4 years. And a big problem with this is, if you go back during the start of the pandemic, a lot of vaccinations were missed, which is leading to things like this happening. Alrighty, this is really sad. Toddler dies on Disneyland trip after catching COVID and a common virus. Now, I'm not going to read the whole thing to you, but it was a 22-month-old toddler who suddenly died on a family holiday after contracting COVID and another common virus, his parents say. This is really sad, and it just shows that if you're going to do a trip, you have to do it safely. Masks have to be involved, and really limit your contact with other people, especially if you have a young child that may be potentially high risk, because it does say here, Dylan Finley, who was born with a rare condition preventing him from swallowing, began vomiting on his first day at Disney. Then it continued on. Then came COVID. Every person deserves to live. Even if you have a pre-existing condition, that is no excuse for it to be a death from COVID. Oftentimes I see people post, well, they had such and such condition pre-existing, which led to them dying of COVID. It doesn't matter. It doesn't matter. They shouldn't die of a disease that's preventable. We have the proper and effective tools that we can use to prevent the spread of COVID, but no one chooses to use them, and therefore we keep seeing heartbreaking stories like this. It is totally ridiculous. Alrighty, moving on to this day in COVID history. We do have multiple things today on this day in history. May 12th of 2020, Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, NIAID, testifies before the U.S. Senate that experts believe more people have died from COVID-19 than have been officially reported, and warns against reopening too quickly. And I do remember that well. I don't know, though. Was this the one where Jim Jordan from Ohio was really pressing on him? It may have been. There have been multiple cases where some of these representatives and Senate people were just absolutely yelling at him. All right, moving on to this one. On May 12th of 2021, ACIP recommends that Pfizer-BioNTech COVID-19 vaccine for all adolescents ages 12 through 15. And finally, moving on to this. On May 12th of 2022, the number of recorded deaths due to COVID-19 in the U.S. reaches 1 million. And as you now know, it's now over 1,130,000 or something like that. We announced the total yesterday. Initial research suggests that between 4% and 36% of all people infected with COVID-19 will experience symptoms lasting at least 6 months, potentially leading to between 5 and 25 million people in the U.S. experiencing a long-term disability. Approximately 200 million people worldwide. Experts and disability advocates worry that the long-term consequences of this virus are underappreciated. And yet here we are. Everything's wide open. Everyone's acting like, oh, it's over. It won't happen to me. And then it does happen to you. Then you regret what has happened to you. But unfortunately, you're already at the point of no return until some better treatments come out where we can possibly cure long COVID. All right, moving on to wastewater. Some good news on wastewater. And dare I say some surprising good news? I'm actually kind of shocked. But take a look here. All 4 regions, all 4, 1, 2, 3, 4, of the United States are dropping for wastewater. We'll have to see if that holds, though. In case you forgot, this is Mother's Day weekend. A lot of people are going to go see their mothers. A lot of people are going to be going to nursing homes. We're going to do something on that tomorrow. I think tomorrow I'm going to do a video on how to properly visit a relative in a nursing home. Does that make sense that we do something? Because I'm seeing a lot of concerning things going on with nursing homes. It's really starting to bother me. So we'll do something with that tomorrow. Taking a look at the national wastewater map, we're not going to spend a lot of time on this. We're going to do a wastewater update video this weekend. It'll probably come out on Sunday, Mother's Day. And there is some good news to report. Real quickly, I want to say this. This is local to me. Finally, the Centers for Disease Control added the 3 wastewater sites in Philadelphia County. They haven't updated. I've explained before, there's an issue. Our testing out of Philadelphia has to be sent to a lab out in Michigan. Don't ask me why we don't have a lab here in Philadelphia. We have some wonderful universities. Don't know why they can't process that here, but hey, that's up to the Philadelphia Health Department. But at least it's finally made it onto the map. Alrighty, moving on to this. Here's what's left of the CDC transmission map. Yep, it does not exist anymore. However, we do have this from Hubbub data, which shows the COVID index. So the greens, not bad. Purple, that's bad. That means COVID's bad in your area. And you can see here, New York City, the spread of COVID, it's definitely there. It's on a high level of this index. California, you do have a couple red areas, which is on the verge of being pretty bad. But then we come to Illinois. You can see Chicago is bad, and we noted last week that wastewater was starting to rise in Chicago. We also have Texas here. Texas is not doing bad at all. There are a few near moderate areas, but not terrible. Thank you, Hubbub World, for this, and they actually told me they're going to start doing daily updates on with their data, daily summary. So that's fantastic. Thank you for what you do. If you did not see our previous video today, that is where we update on the latest variants. I went through region by region. This week's top variant is still XBB.1.5 at 64%. XBB.1.16 is at 14.3%. Then 191 at 9.2%. 192 is at 4%. 2.3 is at 3.5%. Moving on to New Jersey. 173 new cases, 141 new probable cases, 1 lab confirmed death, and 3 hospital reported deaths. Taking a look at the hospital situation in New Jersey, 216 people in the hospital. And let's zoom this chart in real quickly. If you notice here, as we get closer in, the hospitalizations in New Jersey are not dropping anymore. They've actually started to gradually increase. So that's a little bit concerning. And that is definitely showing me that New Jersey is missing cases. And unfortunately, with the wastewater situation, we do have several sites there that have not updated in a while. Remember, there's a big international potential spread that can come from Newark Airport. It's one of the busiest airports in the country. So that could be part of the reason that they're starting to rise. We know XBB.1.16 has been higher in the state of New Jersey. 9 people on the ventilator, and in the ICU, we do have, in the state of New Jersey, there is 22 people in the ICU. Taking a look at Philadelphia, EMS situation, 777 total EMS incidents. Mount Nittany Medical Center, which is up in Center County, Pennsylvania, they have just 4 people in the hospital. Taking a look at New York State, 708 cases reported in New York State. That's a little bit of an increase, so that's something concerning. 1.7% positivity in New York State. 7-day average is 1.9%. New York State hospitalizations are not yet rising, but the fact New Jersey already is, I'm concerned. New York State may start to rise soon, because as you know, they've been bouncing off the bottom. You know, like when you cast a fishing line into the water. 530 people in the hospital, 51 people in the ICU. Real quickly on the international standpoint, worldwide cases are down 31%. Deaths are down 30%. South Korea, cases are 15%. Deaths are up 37%. Alrighty, folks. That does it for today's pandemic update. Remember, we are going to do a special nursing home update type thing tomorrow, where basically we're going to tell you some precautions that you need to be taking going into a nursing home, because chances are a lot of people will be visiting a nursing home to visit their mother on Sunday, and you want to do it safely. And I'm really concerned this could be a source of spread where we see a lot of nursing home outbreaks pop up after this weekend. So we'll get to that tomorrow. Thanks for watching this video. If you liked it, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. Have a safe weekend, everyone. Please do your Mother's Day celebrations outdoors if you can, and do them safely. I'll see you all again next time, but until I see you again next time, stay safe, everyone. Have a great weekend.